Good morning, everyone. Welcome back after a break through the summer. I want to welcome you to today's National Health Engagement Network session. My name is Belinda Boyd, and I'll be your host for today's session, and I'm very much looking forward to it. This is an exciting topic. Before we start, I just want to let everyone know that the session is going to be recorded today. So if you have your camera on throughout the webinar, please note your consent to your image being shared, but solely for the purpose of sharing this meeting with NAN members. So that's our recommendation to you. So please note that. And if you have any questions about that, please ask in the chat. So before we launch into the session, I just want to again acknowledge everyone who's joined us today. And I want to thank you for taking the time to come and hear about this really interesting topic. I think you'll be very glad that you joined to hear what we're about to present today. We have a number of great speakers and presenters, very interesting topics. So as we begin, I'd like to acknowledge the land that we've gathered on. We have our land acknowledgement. So we acknowledge the territories upon which our staff and partners live, work, and play. We recognize the stewardship of the original inhabitants of these territories. Myself, I'm coming to you today from the unceded territories of the Tsleil-Waututh, most specifically the Musqueam. I sit in Richmond, British Columbia. I would invite you to chat in and share with us where you are, what territory you are currently inhabiting, and share with us any other comments you want to make. So thank you for joining with us today. And we welcome those who are here for the first time. This is the National Health Engagement Network, and I know that everyone that is joining us today is not just from NEN. We have guests joining us today through Cascades, who we're co-hosting this today with. So please share with us where you're from, where you're located in this beautiful country, and what territory you're on. So I'd like to introduce our panelists for today. We have an amazing group of people. So we've got Kate McLeod, and Kate is the Communications and Events Coordinator with Cascades. And you'll learn all about Cascades momentarily. Amy Ma, who's a patient partner with Cascades. Terry Howrish, who's also a patient partner with Cascades. Sandra Kettler, patient advisor. Daryl Quantz, sustainability lead at Fraser Health. And Dr. Susan Deering, family physician at Sunnybrook Health Sciences Center. So we're going to start today with a presentation from Cascades. They're going to set the context for the discussion and the learning today. So I'm going to pass it over to Kate, and thank you so much, Kate, as you take us through.
Thank you so much, Belinda. So as Belinda said, my name is Kate McLeod. I'm the Communications and Events Lead for Cascades. And if you go to the next slide, we've got a wonderfully large and mixed audience here. As Belinda said, we've got some Cascades folks, we've got NENS folks, which is super exciting. So I'm just going to take these next few minutes to give some context on how we're thinking about these connections between climate, health systems, and really focus in on what these connections mean for patients and communities. So if you go to the next slide, I'm here speaking on behalf of Cascades, which is a pan-Canadian initiative funded by Environment and Climate Change Canada. We support the implementation of sustainable healthcare practices and policies in Canada. Cascades was established in 2021, and it's an initiative of 4 founding partners, which you see on your screens right now. But 4 years in, we work with and learn from many other organizations and individuals across all provinces and territories. I myself am based at the University of Toronto, and I'm on the traditional territories of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. If you go to the next slide, I'm going to start us off with the climate crisis, a cheerful topic. Climate and environmental change pose an accelerating and complex threat to our health and health systems in the 21st century. And on the next slide, I won't get into too much climate science today, but we've got a great little animation here showing warming over time and around the world. So as many of you will be familiar with, global surface temperatures are rapidly increasing due to human activities and primarily through industrial processes that release heat-trapping greenhouse gas emissions. So on the next slide, we have some of the effects of climate change. And all across Canada, we're seeing these effects impact our communities. And all of us here coming from so many different places, I'm sure most of us will have been impacted directly by some of these, and others will be familiar, whether from news coverage or the experiences of our friends, our family, and our colleagues across the country. Moving to the next slide, our health is determined by many factors, and these climate impacts are some of these factors. As climate and weather become more variable and more extreme, the impacts on human health and health infrastructure are becoming more intense and more frequent. It's important to note here, though, these risks to health are not distributed equally or equitably. Vulnerability, exposure, capacity to adapt or recover, these all differ across individuals, different circumstances and communities, and climate risks worsen these existing health inequities. On the next slide, we've got this great visual from Dr. Courtney Howard, which illustrates the impact of climate change on our health and health systems. So starting here at the bottom, we've got the ecological foundations. So here we see things like changes in sea level, floods, heat, wildfires. As we move up a level to the next slide, we've got the direct impacts on health. So we'll see changes to how these are being reflected in patients and health outcomes, um, the sorts of things that might appear in a emergency department or in a given clinic. And these are things like with heat emergencies or asthma, dehydration, changes in infectious disease patterns, and then mental health impacts of disasters and also eco-anxiety and ecological distress. On the next slide, moving on another level, we have the impacts on social and structural determinants of health. So these are things like threats to people's housing and livelihoods, disruptions to education, and a general reduced equity. And our final level, all of these ultimately impact health systems and the ability to deliver care. When we have to evacuate a hospital or supply chains are disrupted, access to pharmaceutical products being limited or reduced, all of this impacts the level of care that can be provided. And this is part of why resilience and adaptation to these acute and chronic impacts of climate change are so crucial for health systems. On the next slide, we've got a little bit about climate anxiety, really just reflecting on the fact that our own work as Cascades and also in a national survey that Canada Health Infoway did has really demonstrated that Canadians are concerned about climate change, but many have limited awareness of the impact of healthcare's activities in particular. But what these experiences in this survey shows is that when patients are informed and involved in climate change initiatives, many express enthusiasm in being able to respond to the climate crisis through their care. On the next slide, thinking a little bit about what is that impact. So at the same time as climate change is threatening health and health systems themselves are significant contributors to climate change. As the delivery of care relies on energy consumption, transportation, the use of many different products that all have environmental footprints. And so in total, an estimated 5% of global greenhouse gas emissions are produced by the healthcare sector. And we've got this paradoxical situation where the very sector that's working to protect human health is also contributing to the changes to climate that threaten health. On the next slide, we see Canada's healthcare sector is no exception to this. So in 2014, which is the most recent year where there's a system level estimate available, Canada's healthcare system produced an estimated 33 million metric tons of CO2 equivalent, which is about 4.6% of the national greenhouse gas emissions. And it's a fact that we have to contend with, that Canada has one of the highest per capita healthcare greenhouse gas emissions in the whole world. So what do we do about this? Go to the next slide. There's important work happening all across the country to support health systems that are high quality, resilient, sustainable, and with lower carbon emissions. Collaboration and patient engagement are crucial to health system or to health and health sector sustainability efforts. There are so many examples of health system greening initiatives that simultaneously improve patient experience and support patient-centered care. And we can explore ways where the agendas of sustainability efforts and patient engagement efforts converge and can support the needs of both groups. And even thinking very strategically, patients and caregivers are so often engines of health system change, and engaging these groups is a really great strategic move as a important strategic ally in creating lasting and meaningful change. On the next slide, we've got a graphic that was produced as part of our strategic planning resources that Cascades has created, really reflecting on the fact that developing strategies to communicate and engage with patients, caregivers, communities is one of the most key practices that organizations can take to advance planetary health and sustainable care. And so at Cascades, on the next slide, we've got a overview of some of the work that this threads into. At Cascades, we focus on a number of priority action areas where there's clear evidence and experience to support decisive action. And then within these areas, we work across three key streams. We create resources like the one you just saw on the previous slide, where they're implementation resources with practical guidance, either covering things like quality improvement, leadership, and other system enablers, as well as care pathways like pharmacy or sustainable kidney care. If we go forward again, you'll see we also have training opportunities, building the capacity across Canada to engage in this type of change. We've got a whole suite of training opportunities for different formats, audiences, levels of depth, and we'd love and encourage any of you to reach out, find out more about any of these. We'd love to have you participate. Many of our foundational courses go deeper into some of the core concepts that I've gone through very quickly today. These connections between climate change, health, and health systems. But we have a number of different ways to engage. So things anywhere from 20 minutes to 4 hours, synchronous, asynchronous, and opportunities in both French and English. And finally, on the next slide, we have pan-Canadian coordination. So with activities like communities of practice, national and provincial leadership collaboratives, and working groups on key priority areas, we bring people together to put many, many minds and hands on these important opportunities for change. So on the next slide, there's some examples of how these streams of activities have included different aspects of patient engagement. I'm not going to get too much in the details beyond what you see on the screen here, just because we have such great case presenters coming up and they can speak directly to examples like the ones you see here. So instead, I'm going to go right on through to the next slide. The quick note about our advisory committee. There's more details on the screen than I'm going to actually go through. I really just want to acknowledge Amy and Terry, who are with us today. They're our patient partners, and they've been absolutely invaluable to the development of today's webinar. I'm so glad that you both could be here today, and I'm really looking forward to hearing your perspectives when we reach the guided Q&A. I'm going to leave it here. So on the final slide, we've got some suggestions of ways that you can keep learning with us from our self-paced online course that you could get started with right away. We've got another event coming up this week, or coming up this month, I should say, on a similar topic, expanding on that strategic planning lens to um, uh, patient engagement, community engagement, and communications. And we also have a new cycle of our ECHO, which will be starting later this month. All of these are different intensities of engagement, different ways to keep learning and to keep connecting with other people who are combining these two streams of sustainable care, patient engagement, and ways that these can be incorporated in our health systems. So with that, I'm going to hand things back over to Nen for some more details of the principles of patient engagement, and I'll see you all again at the Q&A.
Thank you so much, Kate. It's such a critical topic, and I'm so grateful that you're here to share this with us today, as well as the rest of the presenters. The National Health Engagement Network is a network of engagement practitioners. And just to do a little quick bit of history, it's been in effect for over 15 years now. And it really is a community of practice for people who are practitioners in this area. And I know when we embarked, Kate, when we all started talking about, how critical it is to have engagement within this area of focus around environmental health and the impacts. I know you were really seeking and wanting, and the panelists that are here today are going to talk to us about how they have partnered with patients and people with lived experience. So I just want to touch on a couple of the principles of those, which I know everyone here is probably very well versed in. So we'll go to the next slide. Thank you, James. So these are just some very high-level kind of key principles that I wanted to share before we start in, because you're going to see those reflected in the presentations, but as well, the intent is to have some discussion following this to really solidify and discuss the importance of meaningful engagement to support decisions, especially in this area. So when we look at it, we want to certainly involve broadly. We want to make sure that all that are impacted by the decisions, especially as it related to these environmental impacts, it's such a key and important topic to so many people in today's world. And we need to be involved. I think people want to, as you said, Kate, there's more and more interest. It's being generated all the time. Generationally, people are becoming more aware and they want to be involved in these decisions. We want to ensure that the recommendations of engagement are embedded in the actions and the outcomes. Ensuring sustainable decisions are reliant on the recognition that the needs of all those impacted are reflected. Ensuring that, especially as it relates to sustainability in our environment, we have sustainable decisions as to how to approach and work in those areas. And then engaging inclusively, designing the engagement so that those that are most impacted are involved in the design of the engagement, but also in a way that makes it accessible for all who need to be heard. And those are some of the things that I think people are really seeking to do. And you'll hear from the panelists here today about how they have engaged, but also they're wanting to hear from us and you as a community practice, how best to engage, what are the principles and the best practices. And then communicate frequently and with honesty. Ensure that there's constant communication that is being exchanged, and that you're able to do that with transparency, and to be able to share all the information as you're going through your engagement process, at both before, during, and after, throughout the process, to ensure that transparency, because that's the way we get to good decisions, and then from there, good outcomes. So I know that this is probably a lot of just review for people, because they know this, they practice this. We have a lot of practitioners. So I want you to just hold this, and as we move into the presentations and you hear from those who have been very involved in engagement to achieve some decisions and recommendations and actions, and hopefully better outcomes, better sustainable decisions in regards to health and the environment. Keep these in mind and look forward to some really in-depth discussion following the presentations. So with that in mind, I'm going to introduce Sandra Cutler, who's a patient advisor, and she's going to take us through her presentation. Thanks, Sandra.
Thank you so much. So I will introduce myself a little bit more. So I go by Sandy. So my name is Sandy, and I'm a wife, mother, sister, and friend. I was a physiotherapist for decades and have been a patient partner for 8 years. I was raised to love and take care of our planet. I'm calling in with gratitude from the unceded and traditional territory of the Syilx Okanagan people. It is such a beautiful land of lakes and mountains, and I am so thankful to be able to live and learn here. I live with a few chronic conditions, and I have had experience switching to greener inhalers. Earlier this year, as per best practice guidelines, I had spirometry testing to confirm my asthma diagnosis. And to the amazement of all, it was found that I actually don't have asthma and now have discontinued inhalers altogether. I have a different diagnosis now and will have better health outcomes with the correct treatment plan. Deprescribing is even better for patients and the planet. Today, I've been asked to share some of my experiences as a patient partner in planetary health and sustainable care initiatives and projects. As I share these with you, I hope you can see yourself as a healthcare partner or as a patient partner or as a climate conscious warrior in my examples. Next slide. My first engagement in a planetary health project was a physician-led Greener Inhalers Quality Improvement Project, led by Dr. Phil Huey from the Fraser Health Authority. I was a patient partner from outside his health authority, as I live in the Interior Health Authority region. Often having a patient partner with lived experience is the most important factor, not geography. At the beginning, we emailed back and forth for me to learn about my role in the project and where my input would be needed, and for Dr. Huey to meet me and hear about my experiences. We ensured that we both felt we were a good fit to work together. Next, he invited me to a team meeting so I could learn more about the project and meet everyone involved. In this engagement, I collaborated with 3 of his team members on 3 aspects of the project: a Greener Inhalers educational poster, a sign about returning spent inhalers to their clinic, and a script for physicians to use when talking to patients about changing to greener inhalers. In each project area, with clear timelines, I provided feedback around plain language, white space, readability, and graphics, all from my patient-centered viewpoint. We communicated back and forth using email for the draft documents, and then later I was provided copies of the finished versions, and I could see where my input was used. I was thanked for my involvement at the end, as well as all through the project. I really appreciate that. Next slide. My next planetary health engagement was with Cascades Canada when I co-presented in session 3 of the Climate Conscious Inhaler Prescribing course. I was a member of the panel co-presenting educational information. The ask to be involved was made in an email that included all of the details: when the webinar would be, how long it was, whether any compensation would be provided, and all the preparation that we would do together. As always, I was asked if I had any questions and was thanked for my time and efforts all along the way. We met several times to collaborate and co-create the content of the webinar, and then the Cascade staff did the work of putting the script of the webinar together. I really felt heard and saw that my thoughts were included in the script. Next slide. You can see that we were included in the program as panelists, sharing our lived experience. And next slide. As patient partner panelists in the webinar, we talked about possible concerns for patients when changing to a greener inhaler and the pros of greener inhalers. We shared that there is a need for education to assist patients in making decisions that they feel comfortable with. Having persons with lived experience speak to these points was really important. Next slide. Pardon me, I have a dry mouth. My next engagement was with Health Quality BC's Low Carbon, High Quality Initiative, where I was a panelist in their Patient and Family Engagement Sustainable Quality Improvement webinar, along with Dr. Philip Hui, who led the Greener Inhalers project that I described earlier. We talked about key factors for a successful and authentic patient engagement that we had experienced together. Here's some of the points that we talked about. Having the right fit for both the healthcare partner and the patient partner. Having role clarity, although the patient partner role can sometimes change throughout a project. Ensuring team readiness, including introducing the patient partner to the team. Having clear timelines for reviewing materials and all through the engagement. Determining the best communication methods, taking into account patient partner preferences. The importance of acknowledgement throughout the engagement and again at the end. And closing the loop, ensuring the patient partner knows when the project or initiative is complete and what the impact of their involvement has been. It sounds obvious, but due to the nature of projects, often flowing right into the next project, closing the loop with patient partners can be missed. We also talked about my roles as a patient partner, reviewing patient-facing posters, signs, and educational materials to ensure plain language and readability, and co-creating a physician script. Patient partners can also be involved in co-presenting in patient and provider-facing educational webinars, developing the content of patient surveys, as well as completing surveys, and journey mapping. Patient partners can sit on steering committees and working groups and can provide input into strategic plans, briefing notes, other documents, and publications. Next slide. This brings me to my next engagement when I was asked to review Planetary Health for Primary Care by Alona Hale, Dr. Alona Hale, with support from East Kootenay Division of Family Practice and Cascades Canada. I spent time reading through the draft document and then shared my feedback by email. My name was included on this second page with all the other reviewers, which was wonderful acknowledgement for my time and efforts. Next slide. These next pages of the document aren't meant to be read in full, but you can see the colored boxes. These boxes both include my patient partner quotes. Including a patient partner quote highlights the patient perspective and experience and amplifies your message. At the end of this engagement, it was so nice to be thanked again, and I was given a digital copy of the published document. Next slide. This is where I live, Kelowna, British Columbia. Currently, I'm involved with the Interior Health Authority's Greener Pharmacy Initiative with Amanda McKenzie and many others. So far in my patient partner role, I have provided input on a poster, a patient handout, a briefing note, and recently co-presented in an educational module for physicians about greener inhalers. So to sum it all up, there are so many roles for patient partners in all kinds of planetary health and sustainable care initiatives. Include us early on and often, so our voices are embedded in the work that is so important to us all for healthy people and a healthy planet. Thank you.
Thank you, Sandy. That was great. Thank you so much for sharing the work that you've been doing and the amazing projects that you've been involved with. I'd now like to introduce Daryl Quantz, who is the sustainability lead at Fraser Health. Over to you, Daryl.
Thank you. Yes, hi everyone. Thank you so much for the opportunity to share my experience at Fraser Health with you. As mentioned, I am the sustainability lead for Fraser Health. We're a small team supporting the Fraser Health Authority. If you go to the next slide, please. I just want to start by acknowledging that Fraser Health provides care on the traditional, ancestral, and unceded lands of the Coast Salish and Inkla-Katma nations and is home to 32 First Nations within the Fraser Salish region. And as noted earlier, with respectful acknowledgement of the environmental stewardship role that Indigenous peoples have played since time immemorial. If you go to the next slide, please. Just for context, in case you're not familiar with Fraser Health, it is one of Canada's largest health regions, providing service to 1.9 million people, including 62,000 First Nations, Métis, and Inuit persons. From the Salish Sea to the Fraser Canyon, you can see our 13 hospitals. We're a very, very, very busy health region, and so lots of opportunities to make an impact on sustainability. If you go to the next slide, please. So just starting off with planetary health, because it is such a core of our work. It is a relatively new discipline, but of course we recognize that First Nations and other Indigenous peoples have long understood the connections between our health and healthy ecosystems and healthy environments. And that it perfectly sums up what we mean by planetary health. It is recognizing that two-way relationship and that we rely on a healthy planet to survive. So it is such a core of the work that we do. The next slide. It also provides us an opportunity to take this agenda beyond just climate change, recognize that wider environmental degradation and challenges are just as important. And you can see here the planetary boundaries and that we are moving towards crossing the safe operating space for life on the planet just in such a short period of time. Next slide, please. So what are we doing about this at Fraser Health? Next slide, please. Well, core to our work was actually developing our sustainability and preparedness strategy. It's a 5-year strategy from 2023 to 2028. It aligns with our organizational priorities, which is amazing that we have that support from leadership to support creating our vision of a healthy planet, healthy people, and healthy communities. Next slide, please. Also, making sure that our messages, again, going back to that relationship, that climate change and wider environmental degradation has such an impact on so many different areas of our health and well-being. Climate anxiety already got brought up. You remember the impacts that we had from severe floods and the heat waves from those acute events, but also the impacts on the wider determinants of health, as well as wider impacts on chronic disease. Next slide. As mentioned earlier, we're also recognizing Fraser Health that health systems have big carbon footprints and use of other natural resources. We recognize that if global healthcare was a country, it would be the world's 5th largest emitter, and that we have an opportunity to go beyond just what we're required to report on, at least here in British Columbia. It's actually just a very small proportion of the actual carbon footprint and ecological footprint of our healthcare system. So we've done work to better understand things like our anesthetic gases, our meter dose inhalers, our transportation, our food, other areas beyond just the heat and energy from our facilities. Next slide, please. Of course, we also recognize that planetary health is part of reconciliation because climate change disproportionately affects Indigenous peoples, but also so grateful for the traditional knowledge and environmental stewardship opportunities. And we want to support that Indigenous environmental leadership, and we work very closely with our Indigenous health team and Indigenous partners. Next slide, please. So how are we engaging our patients? I just would like to say this is a new area for us where we are learning all the time, but I feel really proud of what we've been able to do so far. And so I just want to share with you some different examples of work that we've done. Next slide, please. First of all, we actually, when we were first developing our strategy, we wanted to get a sense of how important this was to our patients. So we have a platform in which we provide surveys to our different patients, partners who have signed up to participate. And we found actually that 85% of respondents said it was important to them that the healthcare system reduce their carbon footprint and waste. And so it was very important for us to have that acknowledgement of a priority that this issue is. Next slide, please. Similarly with adaptation, 82% noted that it's important for the health system to actually help communities adapt to climate change. And that's an important piece of the work that our population and public health does to help our communities in that adaptation role. Next slide, please. Work around patient partners is around kind of three key areas. Our sustainability team is a member of our monthly Fraser Health Regional Patient and Family Advisory Council. So we're able to take updates and seek advice from the council on a regular basis. We also ask for two patient partners to support our work, and we now have 2 dedicated patient partners who advise on both social and environmental sustainability. Our patient partners are also members of our regional sustainability steering committee. So through those different avenues, we've got lots of different opportunities to seek advice and engage our patient partners. Next slide, please. So some examples of how our patient partners have supported our work and how we've worked so far is we meet with our patient partners. We would advise them on the issue that we're working on, the initiative that we're working on. So in this case, it was looking at how our health region could become a living wage employer, and talked about engaged with our patient partners to understand why we're doing this and get their feedback on it. And if we go to the next slide, please. And once they were informed and had a chance to ask questions, there was a chance to get that feedback, and it actually included in our strategic documents. And Sandy had just noted the power of patient quotes, and you can see here these quotes from our patient partners in supporting this initiative, and that was very powerful in the proposals that we put forward to senior leadership. The next slide, please. Inhalers. This is a chance to do actually research and understand stronger patient perspectives on the environmental impact of inhalers, and we actually published this, and I can share the links to this in the chat. Go to the next slide, please. And the results of this survey found that actually 80% of patients were not aware that some types of inhalers had an impact on the environment. So it was important for us to actually just understand where patients were coming from. We know that there's a lot of awareness still to be built among our providers as well, but it was great to have that patient perspective and know that patients weren't aware of that impact. And if you go to the next slide, please. Conversely, though, 57% said it was very important to be able to choose an inhaler with a low carbon footprint if it provided the same relief for their symptoms Similarly, 26% said it was slightly moderately important. So we know that a strong majority noted that it was important to be able to access low carbon care. Next slide, please. We also are wanting to use existing approaches to gather information about how we're doing in our implementation of our sustainability plan. So in Fraser Health, we have a real-time patient experience survey that we use to collect feedback from the people we serve, patients, clients, residents, and their care partners. And of course, we use this feedback to support care quality, safety, and experience improvement. So we actually worked with our patient partners to develop a question around this, and we came up with, did you see us take any steps to protect our planet? And we're just starting to roll this out, piloting it in one clinical area, and look forward to actually having this as such a key indicator that we can collect on a regular basis to see how we're doing. Next slide, please. The natural environment, that is also part of our, just as important as it is to reduce emissions, it's also important. It's just as important to focus on the land that we steward and look to increase biodiversity and natural environment at these sites for the benefit of our patients, partners, visitors, and the community. So if we, and we've actually, we have our patient partners who've been doing site tours with us to understand how we can enhance the environment, even look at an opportunity to create pollinator gardens, even place wild bees adjacent to a site that could that the pollinator gardens would support, and also looking at how we can use these enhancements to make our sites more resilient to climate events such as flooding. So it's fantastic to have that support from our patient partners on this work. Next slide, please. And the other end of the equation, just trying to support efforts to reduce throwing out equipment and making sure that there's innovation to repair items. And so we had our patient partners come and join us on tours to learn about an existing model in another health authority and how we could both save costs and reduce our environmental impact through developing a machine shop of our own in Fraser Health. Next slide, please. And I think that's it from me. Thank you so much for letting me share these experiences.
Thank you, Daryl. We have a little bit of time, so I wanted to ask you, because in the chat, people were very interested in your patient survey and if you've published it, or if you have. Yeah.
Yes, I have, and I will put it in the chat. We published it as a blog in the BC Medical Journal, so I will put that so people can access and reference that.
Excellent. Thank you. And yeah, love the machine shop idea. That's great. We don't just throw stuff away, right? We don't
Exactly.
Fix it and put it back into good use. So thank you so much. Now, I'm very pleased to introduce Dr. Susan Deering. And Susan is a family physician at Sunnybrook Health Sciences Center. So over to you, Susan.
Oh, thank you so much, Belinda. So I was asked to share about a project that I've been working on for just over a year here at Sunnybrook, in collaboration with a number of other folks here. We have an interprofessional team that you'll hear about in a minute, and really focusing on how our patients have been partners in this project that is focusing on heat resilience. So if you could go to the next slide. So you've had background about climate change, and we know that things are getting warmer. And so this project really focuses on that one particular aspect that Kate talked about earlier. There's all kinds of health impacts from global warming, but heat is clearly one of the ones that's sort of in your face, if you will. So various studies have shown various projections. So we're using this number. So we're projecting that at least a 21% increase in heat-related hospitalizations by 2050, and that is hospitalizations, not heat-related mortality. There are other numbers for that. We, as background for this project, we looked at how many people have access to air conditioning or other cooling devices. And in Ontario, the numbers look pretty good on paper. 85% of households have air conditioning. For older adults, and that's the population that I have primarily been working with in my clinical practice, most of them, again, 81% of older adults who live alone have air conditioning. However, if you take those numbers and ask the question, well, how many people does that actually represent? In Ontario, that's about 2.3 million people that don't have air conditioning. And so that increases their risk that they will have heat-related illness. Yeah, and you'll see the fourth point there, that we really don't have data on people who have mental health disorders, and specifically we're thinking about people with severe persistent mental health disorders, something like schizophrenia or something like that. And the reason why we mentioned that specifically is because of the data from the 2021 BC heat dome showed that of the people that died, the vast majority were older adults who were living alone. And another significantly impacted group was people with severe persistent mental health disorders like schizophrenia. They are at significantly higher risk from heat-related illness. And so our project really is focusing on these two groups. So the good news is that in Ontario, with a prescription, some people who are at risk can get funding to help them purchase a cooling device. And it's called a discretionary benefit. There are other names for it, but some people with a prescription can access some funding. So this is where our project started. What we were hearing was, okay, it's great to have this funding available, but is it being used? Because we were sort of hearing that after you get the prescription, it's a bit of a process, and sometimes you don't actually end up getting the cooling device. And so our project started with questions that we had about how does this work, and is there a way that we can help facilitate this from a family practice lens? So if you could go to the next slide. We started off with a lot of things that we didn't know. We didn't know how often these benefits are actually being accessed by people who need them. What happens after the prescription is written? Are there barriers that prevent people from accessing the funding, even though they could benefit from it? And are there best practices that would help us as family health physicians and family health teams actually be able to get that funding and make use of it? So one of the aims of our project was to really help family health teams to assist patients who are vulnerable to heat, get that funding and get a cooling device in their home. So again, to the next slide. Our project has two phases, and the first phase is what we call a qualitative study. And if you're not familiar with that language, a qualitative study is a study that really focuses on getting input from people with lived experience, whatever the question might be, talking with them. It could be individually or in groups, and taking all of that information that they provide to you and distilling it and sort of finding out, are there themes, are there things that we're hearing over and over again, that then we can come up with some conclusions. So it's not finding numbers and doing a statistical analysis. It's talking to people and finding out about their lived experience. And so that was where we wanted to start, because we wanted to find out what happens after you write that prescription. And we specifically are looking at talking with people who are in those two patient groups, the older adult patient group and people with schizophrenia, regardless of their age. The second part of phase one is a scoping review, and I'm not going to go into that because we're really wanting to focus on the patients and the impact that that has had on this project. Phase 2 is to use the insights from phase 1, from the what we are hearing from patients and their lived experience, using that experience and that knowledge to inform a quality improvement process to help family health teams help their patients to get the funding that they need. So if you could go to the next slide. In a nutshell, this is my very, very simple diagram of what we're trying to do. So writing the prescription is the easy part. What happens after that? And how can we make that process easier and better so that the person actually gets a cooling device and is able to use it in the end? So if you could go to the next slide, I'll tell you a bit about where we're at with this project. So first off, I told you that our project includes an interprofessional team. So we've got a few physicians on the team. We've got some social workers. We've got a quality improvement specialist. We were able to get some funding to hire a research coordinator, and we have a patient advocate who is involved. Our patient advocate is an older adult herself. We don't have a patient advocate who has experience living with schizophrenia, and this would have been really helpful, but it is challenging to engage folks with schizophrenia. I'll be honest, there's a lot of distrust of healthcare systems and distrust of talking to people that they don't know. And so we're very thankful that we have the patient advocate that we have. And I'll tell you a bit about what her input has been helping with. So far, we have been able to interview some care providers who have been involved in helping patients access that funding and access their cooling device. And we've had some interviews with patients. And if you could go to the next slide. So what have we heard so far? Really and truly, when we were starting this process and starting to talk about, okay, what might we be thinking about and in the phase 2 part as an intervention, we really truly, that the slide with the black box in the middle, that's truly what it was like. We had no idea about what the process even looks like. And so this opportunity to dialogue with patients with lived experience has been invaluable in terms of shaping and informing what we're going to be moving forward with next. So we've heard a few different things. For some people, the process of applying for funding and getting their cooling device has been pretty straightforward when they have assistance from a caseworker. Most people have said it doesn't make sense, the timing, and the background to that is that, so for example, there is funding available from the City of Toronto. The funding is available, you can only apply between June and September. So this is a bit of a problem because if it takes 4 to maybe 8 weeks to have your application approved, by the time you actually get the funding and get your cooling device, hot season is nearly over. So the timing of the applications is problematic. It's too late in the season because things are already hot. And if you're shopping for a cooling device, they really are on sale before the heat season starts, just like with most things right now in the stores, you're going to see stuff for winter as opposed to stuff for summer kind of thing. So those were some of the things that we've heard. We've also heard that beyond the funding and actually getting the funding, actually operating an air conditioning unit can be a barrier for some of our frail older adults. If they need to empty a water bucket that fills as the air conditioner works, they can't actually do it. They just can't physically manage it. And so, providing funding is one thing, but then actually operationalizing it and making it something useful for patients is a completely other thing. And for many people, we heard that the funding is good. It may not be enough. And just to give you a little bit of an idea, it's somewhere between $300 and $400 for most people, which, you know, it will help to offset the cost, but to really get what people actually need, it may not fully cover the cost. And when you're looking at people who are living on fixed incomes, who are on a disability assistance program or something like that, it may be the choice between spending those extra dollars on a cooling device versus buying the food that you need or paying your rent. And so that too can be a barrier. If you could go to the next slide. So what are we going to do next? And I'll say first, we're not done with that process. We're still in the process of gathering more information and hoping to hear from more patient partners and more care providers. But from what we already know, we feel like we have enough that we can go to funding agents. So in our case, the City of Toronto and potentially the Province of Ontario, and take our findings to them in the form of a briefing note and to make some recommendations. To make some very concrete recommendations, such as, like, you need to reconsider your application window. It shouldn't be June to September. It should be, you know, March to April, so that people can actually get these things in place before hot season arrives. You know, by the time June hits, it's already been hot. And then we want to take that information and we want to help our primary care teams, our family health teams. How do you identify who you're going to talk to about this? And then making sure that those teams are aware of the level of support that's needed from social workers or occupational therapists to actually get the devices in the home, so that the person can make use of it, and overcome those barriers that we've come across. So our patients have been providing invaluable input, and we're really excited to be able to partner with people in this way, and really, you know, meet people where they need it on the ground. Thanks for giving me the opportunity to share about our project.
Well, thank you so much, Dr. Deering, and thank you for a really exciting presentation. It generated a lot of comments in the chat. So we have a couple of minutes before we delve into the discussion. So I just wanted to address some of them. There was one that said it would be interesting to look at air conditioning access for people with other disabilities or that have low income, if that's a factor. And then there was one that said that will you look at other conditions like chronic depression. There was a comment about a BC program that was providing free air conditioners to people that were connected to home care or had already some connection. But I just want to comment that I'm just amazed that you persevered in this to track the process and to have such an incredible outcome, which is quite amazing. So good on you guys. And I'm super excited to get into the discussion now, because we've heard 3 amazing presentations. We have with us a panel of 5, the presenters, and including the presenters, we've got the 2 patient partners, Amy and Terry. And these are the discussion questions that we're going to start with. But I would absolutely invite you to chat in questions or comments as we go along. And once we've moved through the discussion questions, we're going to address any questions in the chat. But this is really interactive. It's a chance for the panel to highlight and share with you all the experiences that they've had along the way. But because there's this great group of people here that have a lot of professional practice around engagement, we're looking forward to your input as well. So to get us started, the first question, at what stage of your work would you engage or do you engage patient partners? And I'm going to ask Terry if you would start with that and tell us from your perspective, what do you feel is a good time frame to do that?
Oh, hi.
Hi.
Yeah, just maybe just a real quick moment I can introduce myself.
Absolutely.
So my background is I'm a cancer survivor, and I got involved in patient partnership and patient engagement and cancer research back in about 2017 on the preclinical and clinical side of cancer research. And currently, I'm posted at the uh, Ontario Institute of Cancer Research, where I'm the chair of the Patient Family Advisory Committee. And we have over about, I think it's about 140 patient partners now involved in inputting into cancer research. And so the experience that I really bring to bear is really focused on it's coming from that cancer research background where we really do a heck of a lot of patient engagement work with various patients and caregivers, and it's been a very, very successful program to date. So that's where I am. Also, semi-retired professional engineer. I live in Nobleton, Ontario, which is just northwest or northwest of the GTA. Okay, so enough preamble. I guess we want to get into some of the good stuff.
Just before you get started, I just wanted to invite people to open their cameras if they feel comfortable to do that, because it's really great when you can see people's faces. So I would invite you to come on to the screen. We've taken the slides down. So go ahead, and I'm just going to reiterate, at what stage of work do you think patient partners should be engaged?
Early and often. How's that for a succinct answer? So really, I think patient engagement should really take place across all stages of a project or initiative. You know, really the entire spectrum of activities, including taking or participating in onboarding, feasibility and validation on the potential impact of an initiative or project on patient experience and patient outcomes, and really to help validate, you know, the goals and objectives of the particular initiative or endeavor being looked at. I think it can also help patients can also help recruit additional patient partners as needed and attend implementation meetings, get involved in the evaluation of results and knowledge transfer of results. But the earlier, the better to have patients engaged. And, you know, really, if at all possible, right back to the ideation of the particular initiative. And again, taking advantage of the lived experience of that patient to help, you know, really craft a more meaningful and impactful project or initiative. So that's kind of my take in a nutshell there.
Thanks, Terry. How about you, Daryl? What are your thoughts?
Well, I think, as I said, for us, it really has been a learning experience about how we're engaging our patients. I think it's just been such a valuable process, though, to hear perspectives and there was actually I was just responding to a comment in the chat as well about the living wage and the social and the social side of sustainability. And I think for us that we're actually not differentiating between those two. And for our patients, our communities who recognize the inequalities and inequities that we're seeing, I think it's yeah, sort of gone off a little bit, but I just think it's such an important point that was made, and that we really do want to engage our patient partners on not just environmental sustainability, but the social sustainability of our communities.
Thank you. And what about you, Amy?
I don't have anything else to add besides what Terry was saying and what someone else had said. Well, maybe it was Sandy, that we have to be involved early and often. And, you know, just in the chat, just asking that simple question to Susan about whether there was a patient journey mapping of all the pain points. and quickly realizing that it's way more complex, that it's not just as simple as a prescription. There's the question of family doctors, there's the question of caseworkers, there's the question of maybe recalcitrant landlords. And then also, I was just learned that they were giving the money directly to the patients, so there's no accountability. We know when you want to measure impact after, if they really spent the money on the air conditioning or if they spent it towards their rent or groceries instead. So there's that concrete example right there, that they have to be involved early and often. And I really do hope that as they take things into phase 2 and they implement things, that they've got more than one person with lived experience out there, you know, helping to call the shots to make sure that they get maximum impact and benefit.
Excellent. Thanks so much. I just want to open it up. Is there anybody who wants to comment that's not on the panel? Anybody who wants to weigh in on that? At what stage of your work or your project do you feel it's important to engage patient partners?
I see Samantha Green has her hand up, and I will just first off say, before Samantha takes the floor, that this project was actually her idea. And I know Samantha has been really involved in making sure that patients that need them are getting their prescription. She's been one of those family care providers that has had boots on the ground and has been actively working in this space. So I know you have good things to say about this, Samantha.
Thanks, Susan. Go ahead, Samantha.
Thank you. Sorry, I'm just remaining off camera. I actually wanted to chime in to say that Sandy, I was involved in the National Inhaler Project that Sandy was a patient partner for. And a comment that you made, I still think of almost on a daily basis about that meter dose inhalers make a whooshing noise, whereas dry powdered inhalers don't. And that was like an aha moment, oh my goodness, I never even realized that this is what patients are meaning when they say, oh no, the dry powdered inhalers don't work. It's because they don't hear or feel the whoosh. And I would never have thought of this without you as a patient partner. So thank you.
Well, that's great. Thanks so much, Samantha. And thank you for all of you who waded in, and please keep that question in mind, because we'll certainly go into further discussion. So on the next question, where and how can teams find patient partners who are interested in sustainability and quality improvement? So where and how? So I'm going to go to you, Amy, first, because as a patient partner, if somebody found you, so where do they find amazing people to support these initiatives?
So I'll just take a brief moment to introduce myself. Hi, I'm
Please.
Amy, and I'm zooming in from the unceded territory of the Kanagahaga in a city called Tiohtià:ke, colonially known as Montreal. And I got my start actually in Quebec. We have patients committees, or comité des usagers, which are associated with every hospital and long-term care home that is publicly funded. So the way I was found was I was accompanying my youngest to a follow-up appointment because he had 2 surgeries before the age of 2. And it just happened to be during the week of Patient Rights Week, and they had tables out at the Montreal Children's Hospital Family Advisory Group. So that's how I got found out. So a logical low-hanging fruit would be to have something out during April, in and around April 22nd, which is Earth Day, to put a spotlight on any climate or planetary health initiatives that you guys have got. So that's one way to look at it. And I've also done advisory work prior to Cascades with Nourish Healthcare. So again, that intersection between health equity and climate crisis, adding in reconciliation when you can, using food as a leverage, right? So I'm not entirely, there's many different ways of engagement, and I'm just thinking that the example that Saint Justine has in this area is, I guess, more of a community engagement thing, because they were looking first of all at how can we source food locally when it's in season, and then first of all, it was like how can we get people to eat food that they order, because there's a lot of food that's wasted for the inpatient when it's kids, right? But if the kids are ordering what they want, there's less chance of waste. So there was the staffing issue to make sure that you could have a la carte food at St. Justine Hospital. Then came the emphasis on food that was sourced locally when it was in season. And then came, will this be organic food if it's local as well? So there was this project that was under the auspices of Nourish, right? So that's another way to build awareness, and perhaps from there they can add on something else on top of it where they can get more patients involved. Perhaps because I remember there was one cost saving that they had with this project, which is still ongoing right now with St. Justine, that they saved a lot of money on specialized formulas, because now all of a sudden the toddlers could pick and choose what they ate, which is preferable to having the formula for gavage, whatever that is in English. So maybe they could have something targeted to that. So that's another idea on where and how to recruit patients for stuff related to one particular aspect of planetary health.
That's excellent. I mean, I love how you suggested leveraging like people's interests or time-specific events to recruit and to find people to align with their interests, which is great. How about you, Susan? I know you had some comments you put in the chat.
Sure.
Where and how can teams find? How did you find people?
Yeah. So I have been involved in a number of projects, not just this one, that has involved patients as partners. And so I could speak to, I guess, at least 3 different ways. One, a patient came to me and he said to me, you know, this is my experience. Why are we doing things this way? And that resulted in a project, and he was part of our design and application for funding, you know, sort of right from the get-go. It was his idea. And then with the heat resilience project, this a patient partner is somebody who has volunteered as a patient partner to advocate in other areas of our organization. And so one of the people on our team knew her and knew that she was interested in engaging, and so just asked her, would you be interested? And then another area that I'm involved with at our hospital is we have what we call a green task force, which is focused on improving the sustainability of our organization as a whole. And we wanted to make sure to include the patient, family, and community voice in all of that planning. And so we collaborated with our foundation and just put out a call for community engagement, somewhat similar. I think it was Daryl who made a comment that that, you know, you've used some of the already existing infrastructure that's there. Our foundation already had a way to sort of put out a call to the community and say, hey, we're looking for people to partner in this specific area. Anybody who's interested, comment or contact us. And so in that way, we've been able to engage with patient, family, and community members. And that's been another really invaluable collaboration.
Excellent. Thank you. Anyone else? Anyone on the screen? Anyone who wants to weigh in on that one? Are there existing networks, platforms that have helped you to find people to support your engagement initiatives? See something in the chat, medical societies. Sandy, go ahead.
I get an email from Healthcare Excellence Canada that talks about internal and external opportunities. And so I find that that is this place where I learn about things, and there's other national and regional and provincial organizations that do have networks. We could probably share them if we want, but they're out there for sure.
Excellent. And I would invite everyone to look into the chat too, because there's lots of great ideas being reflected there. Anyone else? I can't see everyone on my screen at the same time.
Isabel had her hand up.
Thank you.
Yeah, I commented on the chat already, but I'm in nephrology, and I'm in both committees from the Société francophone de nephrologie and the Canadian Society of Nephrology, and both have patient partners in our sustainable healthcare committees. So that's a great way to be involved with patients, and from those patients, we've recruited other patients in projects.
Excellent. Thank you. So for teams that are just getting started, what practical advice would you give in relation to, you know, what are the first steps for getting started with an engagement process like this. And I'm going to go to, how about you, Susan?
First steps, I mean, I think just engaging in dialogue, and if I guess it really depends on the project that you have in mind, but for example, with the Green Task Force, we put out the call, we had a few people say that they were interested, and so then we arranged to meet with them and to find out what they were interested in, what their experience was, and how would they like to engage? What were they able to what time commitment could they make, and that kind of thing. So just start the conversation, and I think also being I think many people have said this, like, I think, you need to be thinking about this right from the foundation of whatever project it is, because ultimately healthcare is about patients. It's about caring for people. And so we should be engaging with the people that are impacted the most right from the very beginning. We don't want to make just programs about people. We want to co-design and co-create. And those are the ones that are going to be the most impactful. So start with the foundation and then engage in the conversation.
Thanks so much, Susan. Amy, what would you suggest? How do you get started?
Don't wait for perfect. You work with what you got. For sure, you have to have the budget in place so that you can give people proper compensation for their time. And because people with lived experience, they necessarily might have hiccups along the way that will prevent them from attending 100% of all your meetings. You have to build in redundancy by having at least 2 patient partners. And then it also helps a little bit with the power imbalance, because if you're the lone person with lived experience and everyone else around the table is someone in that health ecosystem that has a recognized title with an organization, it can be a bit intimidating. So have at least 2 if you can. I mean, even better if you can make it 50-50 so that the power imbalance has dissipated somewhat, then people will feel comfortable to really give you the hidden insights that you've been missing all along.
Thanks so much, Amy. So Daryl, with someone with an elevated title like sustainability lead, how do you get started?
So, I referenced the using existing platforms. So having that existing platform of a patient survey that we did, that initial survey that I'm glad people were interested in, because I remember having a student one summer saying, try to find some things in the literature on this, and there just was so little. So having that stat that 85% said this is important to them, that we reduce our carbon footprint and waste. And there were some other pieces in there that we referenced, but it was a really good just starting off point to actually say, we've got some information about this. We know intuitively that climate change, environmental degradation is a top issue for Canadians of concern, but being able to sort of translate that into healthcare emissions and environmental degradation contributions are a concern was a great, it's something that we used right from the start. We used that with our leadership, and then we used that when we went and first started becoming, again, using those existing structures that we first started presenting and becoming part of our regional patient and family council. So so I think just having that starting off point and being able to use those existing networks. So
excellent. Thanks so much, Daryl. I am looking for hands, but I'm looking at Carolyn because she's got her mouth. It's like you're trying not to talk. So if you want to weigh in, she's like, no, I'm not going to say anything. Do you want to wait in? Tell us how do you get started?
Were you referring to
Kate
you. Or to me?
No, to you, Carolyn. Yeah.
Oh. Hi, everyone. I'm Caroline Wong. I'm
picking on her because we just had tea together not too long ago.
Hi, everyone. I'm Caroline Wong. I'm from the Center of Excellence on Partnership with Patients in the Public in Montreal. This has been really great to hear all of this. I mean, for us, it's been a variety of methods, and honestly, everything that you guys have spoken about are great ideas, and we've used various versions of them as well. I think one thing that's important is that often patient partners find other patient partners. So I look at Amy and I see the level at which Amy helps to also recruit others. I think one thing I always like to bring back to the table, which I know Belinda and I have spoken about a lot, is making sure that we always reinforce sort of why patients are at the table and what we're looking for when we reach out to search for patient partners. It's not just a panoply of experiences, which it is, but there's a lot of competencies and skills and knowledge that's really at the heart of all of that, that sometimes is not identified as such. So oftentimes it comes in as a as a as a quote or an experience or a little narrative or something, but actually behind all of those narratives and those anecdotes, etc., is a lot of skills and knowledge and competencies. And the more and more we use that language to recognize those unique care aspects that come only from patients because they have lived experience, or from persons with lived experience in certain social contexts as well, the more we're going to be able to ensure that we it becomes non-negotiable to include them from the start, early and often and always. And also that it becomes also sort of it balances out the recognition of the power that we have around the table, or the powers that we have around the table when we do that. So it doesn't really answer the question as to how did we kind of get started. We got started because there was one patient partner who decided to work with the dean. And from there on, like hundreds of other patient partners have been involved in medical education at the University of Montreal, and so on and so forth. It was a bit of a one at a time and then a rapid scale up from there. But all the methods that were talked about today, but let's not forget that when we do bring people to the table, even if they have, and I saw in the chat, people come with their sustainability expertise, they come with their professional expertise, they come with we're not singular individuals, but actually that when we do bring persons with lived experience around the table, it's because we're recognizing this unique type of knowledge and competencies that come from that lived experience. So that would be my little spiel. Thanks, Belinda.
Thank you. And I just cognizant of time, so we're going to wrap up, but I just wanted to address, there is a couple of questions in the chat, and they are directed at Sandy and Daryl, or whoever, maybe Susan as well. Has the emotional or psychological impact of discussing the environmental impact of treatment with patients and partners ever been discussed? So, for example, have you explored the potential anxiety or guilt feelings of patients when faced with the environmental impact of their own treatment?
I can go ahead, Daryl.
No, you go ahead. Go ahead.
Okay, I'll go quick. It was part of the first physician quality improvement project that I was involved in on greener inhalers. In the physician's script, people that require metered dose inhalers for health reasons, that's totally fine. And the physicians would not even be having these conversations with patients that they did not feel would have the capacity to be successful in changing inhalers. And as a person who with multiple medications and health conditions, we all feel terrible about being ill, and it's ableist society that we live in. And so this is just no different. Environmental impact of medications is no different than the continuum of support that patients need to take the medications that they need to take to be healthy without shame or judgment. So.
Thank you. I just want to, I know there, some of our panelists have to leave. So before that happens, I really want to thank every single one of you, Kate, Amy, Terry, Sandra, Daryl, Susan. It was amazing to hear the work that you're doing, inspiring. I think we're all going away with a lot more just excitement around, what's possible and what you've been doing, and it's very very encouraging.